Hello beautiful people, welcome back to another video. If you're new here, my name is Lesodor and I'm a nursing student at the KMTC Muranga. And so today, in today's video, I wanted to explain to you guys which are the important books that you're supposed to be having in nursing school. And for the books that I'll be explaining to you guys today, it's not a must for you to have these books. I created this video because of the questions that I've been getting on my DM. Like, people are asking, is it a must for you to buy all the nursing books that you are being told to buy? So it is not a must to buy all of these books because most of them are in the library and you can access them there. And even most of these books are in form of soft copies and you can just get them on your phone. So it's not a must for you to buy all these books. You can just buy it if you can afford to buy it, or if you can get it from someone else, because maybe for me, if I'm done with school, maybe I'll give these books to someone else, so you can have it if for either of those options. So let's get to the books. So for me, I do KRCHN, and for us KRCHN, the core is usually midwifery. That's what I know. The core is the midwifery, and that's why the first book I'll be explaining to you guys is the myles midwifery. And the myles textbook for midwives is a really important book because it is simplified, and the way it is explained, it is just so easy to understand. And for the myles textbook, it has everything from pregnancy to labor to even postpartum and even baby at risk. All is included in this book, and you can buy it, or if you can't, we have soft copy, but I've never accessed a soft copy for myles, but we have soft copy for other books like paper 2 and such kind of things. But if you can access any, if someone can give it to you or you can buy it, it's a really nice book. The next book, which is another most important book, especially for first years, is the Ross and Wilson Anatomy and Physiology. So for us nurses, you need to know your anatomy. Like, anatomy is the core for you to be able to understand med-surg, and for you to be able to understand, like, everything you'll be studying in the second year and third year will all be based if you understood your anatomy and physiology. So if you can buy the Ross and Wilson. It is so simple, like, it is the simplified anatomy and physiology I've ever seen. So for us in KMTC, usually use the Ross and Wilson. So if you can buy the Ross and Wilson Anatomy and Physiology, or you can buy any other anatomy and physiology book that is simplified, especially for nurses. The other book for anatomy, which is not usually used by most of the students, is the Human Body in Health and Disease. I know, like, most of the students don't use this book. I got this book from a friend, and the reason as to why I really recommend this book is because it has the anatomy and physiology, and it also has the med-surg in it. Like, for Ross and Wilson, it only explains the anatomy, and when it comes to the conditions, you need to access your med-surg book. And so for this book, the Human Body in Health and Disease, it has the anatomy and the med-surg part of it, and it also has revision questions. So it's so easy to use it. Like, I really love using this book because when I'm done, I just access the questions like this one, and I just determine if I've understood the topic, and it's so easy. And something else is that after the topic, it also summarizes everything for you. It's just so nice. Like, after reading this book, you usually just understand your anatomy and your med-surg at the same time so well. You can also buy the med-surg book, but if you can't be able to buy the med-surg for nursing, you can always have it as a soft copy. Like, for me, I have the book. If you watched my video on Study With Me, I had the book, but it's so heavy. As in, the med-surg book, it's almost I don't know, the size is so big, so you can't be able to carry it all over. Like, for us, you're traveling a lot, you can't be carrying that book every place you're going, so you can just have the soft copy. Like, for most of us, we just have the soft copy. I know most people don't like using soft copies because they say that when you're reading with your phone, it's so distractive, but if you can, it's better for you to have the soft copy. The other important book is your pharmacology book. You can have a pharmacology drug index for nurses, but if you don't have that, you can also have the textbook. Like, for us, we use the clinical pharmacology for nurses. So you can buy this even at Savanis or any other place. Like, for this one at Savanis, it was 2,300, but if you can't buy it, it is usually in the library. A lot of it is usually in the library. So you can buy this book, or you can have a drug index. And for the drug books, it's not a must for you to have it physically. You can even download an app. Like, for most people, for drugs, they usually have apps, so you can be using that app to just look for your drugs, and that's it. Yeah. The other textbook is now for paper 3. You can buy a communicable disease textbook, but some of these are not really, let's say, not really important, because like you can have a soft copy for paper 3 whereby it has everything from communicable disease to the primary health care, the home-based care, all the things that are in paper 3, all in one paper. So it's not a must for you to be buying these books, but if you want a communicable disease book, I really recommend this one by Dr. Eric Nordberg, Communicable Diseases. The other textbook I'll be explaining to you is the child health book, and for the child health book it's really important because it has all the things for the newborns and the pediatrics, and it is so well explained for each and every topic and each and every condition. So this book is usually in the library most of the time, so you can get it there, or if you can have yours. So I'd like to show you these books because at times you'll find like someone wants to give you a book, but maybe it's not the one that is used in your college. So if you're going to KMTC, this is the book that we usually use, that is the one that is usually in the library. Important things that you need to have is a nursing dictionary. So you can always buy, if you want to, you can always have a nursing dictionary just for you to be able to study easily. Like let's say you are studying and there's a word you've met and you don't understand the meaning of the word, you can always look it at the dictionary, and if you can just be using your bundles and Google these words. But if you're that person who just wants to have everything at hand, you can buy the Oxford Nursing Dictionary. Other dictionaries that you can have is the Nurses Dictionary. We have a small dictionary. You can also have the Nurses Dictionary, and you can also have the Midwifery Dictionary. So for me, I usually like having a small pocket midwifery dictionary just for going for clinicals. You can always have it on your backpack, so whenever you go for clinicals you can always be checking the words, because at times you usually go for these word rounds and you hear certain words that you have never heard of. That you can always use your dictionary. So you can have small pocket ones like this one that you can just have them on your backpack. So the next book I'll be explaining is about immunization. So for us, like learning about KP and the whole immunization schedule and all those such kind of things is really important for every nurse. Like I don't know if it's in all countries, but for us in Kenya, like learning your immunization is just something that should be so important. So for the immunization, I usually recommend this National Policy Guideline on Immunization. This one is the 2013 version. So this one is by the government of Kenya. So this guideline is really simplified. Like it's much more simplified than even reading a textbook, and it's just so small. So the guideline explains every condition that is immunizable. Like you can see this one for tuberculosis. It explains everything, the prevention, everything about tuberculosis, then about the immunization, the schedule and all those kind of things. So it is so simplified. And this one, luckily you can have it as a soft copy. You just go and Google National Policy Guidelines on Immunization. It will bring the whole entire book as a soft copy. I usually have the soft copy one, so whenever you just go, like for us now we are on our district, so we usually deal with immunization. So every time I'm free, I just open the soft copy one, and then you can just access everything until the last page. The other important guideline is the National Family Planning Guideline. And so this one explains about the family planning methods. It is also simplified like the other one. They are both by the Ministry of Health, the government of Kenya. So they are all both simplified and so easy to understand. So if you can't get this one, you can always have a soft copy for yourself that explains everything. Like for immunization and family planning, you can get any soft copy. Like for most soft copies that I have, they are all detailed, like just like the textbook. So you can have the textbook or you can even have the soft copy. They're all okay. Then lastly, for practicals, because we also have assessments, so for practicals you'll be using the manual for clinical procedures, and this is the one given by the Nursing Council of Kenya. So this one you don't have to buy it. Like for me, I had to ask someone for it, but when getting to school, you had to pay a certain amount of money for you to be given this book, and it is a must for you to pay. So don't buy this book because you're going to pay for it. Like if I'm saying this for those who are in KMTC, so you don't have to buy this book because when you go to school, you're going to buy it as a must. Even if you have 3 of them, you're going to buy an extra one as a must. So this is the clinical procedure, and usually use this for all the nursing procedures that you're going to do when you go for clinicals. So you'll be using this whenever you want to do your assessments. This is the book you'll be reading and going through. Lastly, you require your course outline. So the course outline is usually given by the college, but most of the time it's in form of a soft copy. So if you want, you can go to the cyber and just get yourself a hard copy. So all you require is just the course outline for you to be able to know which unit are we being taught next, what is included in that unit, and that's all. So guys, that's all for today. I hope I explained most of the books, and if you have any other question on any book that I've not explained, you can leave that down on the comment section. Or if you have any other book that you recommend for a nursing student, you can always leave that down on the comment section. And thank you so much for watching this video, and see you on my next video. Bye bye.